So, welcome to the latest episode of MQ's Open Mind. And today we're delighted. We have a fantastic guest and really good friend of mine. Craig and I are delighted to have today is Professor Ellen Townsend. And Ellen is a professor at the University of Nottingham. So, Ellen, thanks a million for joining us today.
Oh, it's great to be here, Rory. Thanks for the invite. Hi, Craig. Great to meet you.
Hi, welcome in.
And so, Ellen, what we're going to do maybe is a couple of things, right? So, what we try to do in the podcast is really an informal conversation. But maybe if you just begin with, tell us a bit about how you got, because I've known you for, I don't know, it must be over 20 years, it must be 20 years, something like
Can't
that.
possibly be that long, but yeah,
Well, obviously,
I'll trust you. I trust you. Yeah.
Clearly. But it must be something like 20 years. I think it is 20 years. I think it is 20 years.
Yeah.
Sorry about that, Ellen. Neither of us is getting any younger, I don't think. You're obviously going the other direction. You are getting younger. No, Ellen, seriously though, tell us a bit about, because we're both psychologists. But tell us a bit about your journey, because I know obviously I met you first, I think, when you were still working with Keith Houghton in Oxford. Can you tell us a bit about your journey, how you get into mental health and suicide and self-harm research?
Absolutely. So really, my interest in psychology came from an interest in biology. I did music as an undergraduate, and we all had to take a subsid topic, to complement our studies. And I really wanted to do biology because I've always had a kind of interest in arts, science, and humanities. And I couldn't fit biology into my timetable. So I went to my head of department, who was a lovely chap called Julian Rushton. And he said, well, why don't you try psychology? Because they have biological psychology and you might like it. And I fell in love with it. And this was at the University of Leeds. And they were amazing and allowed me to kind of curate my own degree, really. There is now a music and psychology degree course there. But I was able to increase the amount of psychology that I did as I went on. My initial interest was there. I loved anything to do with clinical psychology. I worked as a residential social worker in summer holidays with adults and adolescents who had severe emotional difficulties and learning disabilities. And I worked alongside art therapists and music therapists. So, my combination of being a musician and being interested in psychology kind of really came together. And so I was, sort of developing interests in both those spheres. Then funding for a PhD in the psychology of music came up. So that was my first step into really kind of bringing psychology and music together it was experimental psychology. So I used to terrorize the music students and ask them to do experiments, impossible experiments.
So what were the aims of the experiments?
Well, I was trying to find, it sounds rather grandiose, but I was trying to find the equivalent of the phonological loop for music reading. So the kind of like a tonological loop is what I rather grandly called it. And so I'd get them to do all these kind of multitasking experiments to try and knock out different elements of the skill set. And so that kind of developed my interest in psychology and using different techniques. And then as a postdoc, I was thinking about doing clinical psychology as a career, and then I joined Keith Houghton's team as a postdoc at Oxford, and I really fell in love with doing the research.
But hold on, but I didn't realize that though, that before you got to Keith's group in Oxford, you hadn't done any suicide stuff at all, and had you done any mental health stuff at that stage, apart from I know your social work stuff and whatever?
No. So I had just had a real strong interest in music therapy, which is a very nascent field at the time. It's obviously a lot stronger now. There was very little funding, few places to study. So my thought process at the time was, well, perhaps I can go into clinical psychology because that is a more kind of defined kind of career route. But joined Keith's team and then fell in love with doing the research and kind of stuck as a researcher, which I'm really happy with that because we work really closely with clinicians and policymakers, in fact, in all the work that we do. And so, there's maybe part of me that thinks there's a kind of sliding doors moment, what if I had kind of gone down that route? So it's a bit of a circuitous journey.
Yeah.
And I think sometimes that annoys people. They want you to say, well, I had this really defined career path and I wanted to do this. But actually I guess it was a set of noticing opportunities and stepping into them. And being excited by them that sort of led me to doing research in this field.
Because I think you're right. I think the system is set up for that blinkered approach, and I think we don't allow students or young people or whatever that time and space to sort of explore different avenues. And I speak as somebody who did that very blinkered approach. But I definitely I wouldn't go so far as to say I regret, but I sometimes wish I had the opportunity to do something different before I did. Then obviously do everything on suicide or whatever. Yeah. So then just one last time before back to Keith. So did you know Raymond MacDonald? Was he a name in the music therapy field at the time? Just some colleague I knew from Scotland who in the late 90s, early 2000s, I think he still does it. He's a saxophonist as well, but he's a music psychologist and he does music therapy. Does that name ring a bell? He's a jazz saxophonist.
Yeah, it does. But I mean, my PhD was very much on understanding how, musicians sight read, so it's expertise research. And I had this kind of interest in music therapy that was developing, but it wasn't my area of
Okay.
expertise.
How long were you at Oxford then? And what sort of things you did at Oxford? Because I know you were involved in the systematic review.
Yeah. So I worked on several projects, and the systematic review was the first one, which I took over from Ella Arensman. So Ella Arensman has gone on to be one of the leaders in the field of suicide research. Absolutely amazing, inspirational person. And there was much hilarity because Keith would get us confused because she's Ella, I'm Ellen. We kind of, okay, we both had blonde bobs at the time. And we dress quite similarly. And every time I meet Ella now, we look at each other and go,
Yeah.
how similar are we dressed today? So Paul Keith used to get very confused. So the systematic review was an absolutely amazing way to kind of get immersed in the literature and understand.
And what was that on? What, for the listener, what was that systematic review on?
So it was the psychological and psychosocial and indeed psychobiological interventions of self-harm. So we did the first sort of worldwide systematic review of all the treatments that were available at the time. There were about 20. This was back in 1997, 1998, so a very long time ago. And of course, the field has grown since then. So I worked on that, and then I worked on the EPSIS study, which was a very large European interview study interviewing people who had self-harmed and were in hospital as a result of what they'd done. And we would go in and interview them quite, it was a long, often an hour and a half on the circumstances, psychosocial, psychiatric, personal issues leading up to their self-harm. And so that was the second project that I worked on with him. And then finally, I worked on the impact of the paracetamol legislation. And that was quite exciting because we were able to evaluate a policy in vivo as it had been kind of enacted. And we looked at, what the impact of that legislation, which was to reduce paracetamol pack sizes, the number of pills in paracetamol packs, and see what impact that had in terms of self-harm and suicide-related outcomes. So a kind of mix. It's quite good, lots of different skills that I kind of learned in a 3-year period.
Yeah. No, and God, that was a lot in 3 years. Wow. And then the impact, obviously, of that change in legislation, and as we now know, that has saved countless lives since that. Just obviously the morbidity as well as the mortality rate from suicides, which is fantastic. Okay, so you then went from Oxford, and then what happened next?
So I took up a post as a lecturer at the University of Nottingham. That was over 20 years ago. And I've been here ever since and worked in various different groups and set up the self-harm research group, which I now lead. And we're very interested in adolescent self-harm primarily, and interventions and prevention and what can help with recovery. And we're very, very keen on co-creation. So we work really, really closely with young people to make sure the things that we're doing are really appropriate and suitable for them.
No, so we're going to come on to some of that detail in a second, Ellen. I'm keen to talk about your card sort task as well. But before we do that, can it be really helpful maybe just to set the scene in terms of what the evidence currently tells us about how the prevalence of self-harm? And we hear a lot about, is it on the increase or it's not on the increase? So maybe what's your sense of that? So first of all, how common is self-harm, and do you think it's on the increase? And what do we mean by self-harm? Maybe start with what we mean by self-harm.
Yeah, so the definition would be any act of self-injury or self-poisoning, regardless of the intent associated with the act. So that encompasses a wide range of behaviours and a wide range of motivations. That's how we would think about it, probably in Europe.
Isn't that the UK definition as well in terms of the National
That's
Institute
how NICE
of Health and Care Excellent definition? Yeah.
exactly, that's how they would define it. But from a psychological standpoint, what underpins self-harm, although it's a behavior and the focus is on behavior, what we're talking about is emotional distress. Much of the time, we're talking about people who are feeling, that they're in a situation that they can't deal with the very strong negative emotions that they're experiencing.
Yeah, but even before we get into the emotional distress, obviously there's that. I think you're alluding to that's the definition that NICE uses and what tends to be operationalized in Europe, but there still is obviously that dichotomous view in the United States.
Yeah, so absolutely. So in that case, self-harm gets delineated into two categories. So people who have intent to end their life with the act that they're doing, and those that don't. There's quite a big debate in the literature, and probably don't want to get too hung up on that. But I think from our work using our card sort task for self-harm, the really important thing to note is that those motivations can change over time. So you might, on one occasion, feel that there's no, if you like, suicidal intent behind what you're doing, and on others, there very well might be. So my perspective is that we have to be really sensitive to the temporal dynamics and how these things change over time. So what might be true for one time point is not necessarily the case at another time point. So it's really important to understand for each individual at each time point what that actually means.
And I suppose also the motives can change even within one episode as well. And it depends who's asking the question to try and ascertain motive. And so it's hugely complex. And I suppose that's what really illustrates is that complexity. So then, Ellen, in terms of prevalence, how common do we think in terms of, so I think the figure often for adolescents is 1 in 10 young people or young person will self-harm, whatever, 1 in 5 girls. So we have a sense. What's your sense of, is it on the increase?
Well, it kind of depends how you measure it, and where you're measuring it and the kinds of question you're asking. But I think overall we would say that self-harm has increased. Now, we don't understand why. I mean, there was a study looking at GP referrals, for example. We know that those figures have gone up a lot. We know from studies in schools, the sort of number of students who are reporting self-harm have gone up. There might be a number of reasons for that. Obviously, there have been lots of campaigns to destigmatize mental health and issues around mental health. So that might mean that more people are able to kind of articulate that these things are, apply to them as well. Interestingly, other risky, if you're going to kind of think about self-harm as a potentially risky behavior, other risky behaviors have decreased in adolescence. So there's fewer adolescents drinking alcohol, fewer adolescents taking illicit substances, and fewer adolescents smoking. However, we know we've got a kind of epidemic of vaping going on, which the government is finally starting to address. So there's some interesting things going on, I think, within the signal that, yes, consonant with mental health problems increasing in young people generally, we've seen an increase in self-harm.
And of course, although you tend to focus on young people, it's a recognition of that, just for the obviously listener, that self-harm occurs across the lifespan.
Yeah.
It certainly is very, very rare before puberty. We do tend to see that stark increase in the years of puberty through to your mid-20s, but it still happens later in life. But actually, our estimates of self-harm in the community across the lifespan are pretty patchy, actually, because there are very few studies which have looked at it in the community. And as you obviously well know, Ellen, that most of that research and some of the work you've been involved in as well has looked at hospitals presenting self-harm in terms of the multi-center work that you've been involved in. Do you want to tell us a bit about the multi-center work and then maybe move on? I'm keen to talk about the card sorting stuff task where you're trying to make sense of the complexity of self-harm. But maybe tell us a bit about the multi-center study.
Yeah, so this is work led by Keith Horton and Nav Kapoor, and it's the multi-center study for self-harm in England. So we have 3 centres with about 6 hospitals collecting data in the same way on people who present to the emergency department having self-harmed. and then collecting data around, a method of self-harm, demographic information, the problems that they come to hospital, with, and what has motivated them, or what the problems surrounding the self-harm, and then what happens to them in terms of care after self-harm. And we've been able to link those data to mortality so that we can sort of track what's happening. And, I think I was invited to join the team to deal with some of the, if you like, messier data. So there's kind of quite robust epidemiological data, which is consistent across all the centres, and some of the data, particularly around life problems, for example, when people present to hospital, is a bit trickier to have a look at. And so we've been looking at that in across the age range, and indeed with young people as well, to try and sort of pull apart, well, what are the problems that people are facing, and what does that mean for services? And because obviously the beauty of data like that is that you can extrapolate, what's driving some of these issues, and think about the implications for both services and for policymakers.
That's an incredible resource set, isn't it? It really is. Okay, Alan, so moving on then. So I can't remember how many years ago it was you published or developed the card sort task for self-harm. Can you maybe tell us, well, when was that? What is it? What do you know? What has shown so far? And I know you're doing really exciting work on that at the minute as well. So can you tell us about
that? The card sort task for self-harm, which we call the CATS task, and we originally co-created it with young people through some NIHR-funded research back in 2013. And we were particularly interested in understanding the complexity of self-harm and how it evolves over time. So the card sort task afforded us a way to do that, so that we could take all the thoughts, feelings, events, and behaviours that young people were experiencing, which led to them self-harming, and look at the patterns over time. So we wanted to see across individuals, could we say, actually, there are some patterns here, that this seems to lead to this, and then this seems to lead to that. Okay, so that's where we started this work, and indeed we do see sequential patterning in self-harm, which was some of the early papers that we published. Interestingly, as we wrote in our first paper, the sorts that young people were producing, so we originally did this work with young people, seemed to map on quite neatly to some existing models in the literature, most notably, I suppose, the IMV model, that you have this kind of transition. There are life events that are predisposing, there are, motivational factors, and then volitional factors, which then, and it seemed to hang quite nicely on that model, for example. So that kind of gave us a signal that we were picking up on something that was really kind of tangible and sort of fit in with theory and the literature. So that was really exciting. And in terms of what the really important messages from the early work on this, where I think that we noticed the difference between first ever self-harm and then most recent. So there's a really interesting transition after first ever self-harm to feeling better. So there was something about that self-harm that had done something to improve how that young person felt. However, when we asked young people to do the same sort for their most recent episode of self-harm, that transition to feeling better had disappeared. And in fact, what we saw was a deterioration over time. So in the most recent episode card sort, for example, constructs like I felt like a burden, I wanted to die, I felt worthless, I felt hopeless, started to creep into the sorts that weren't evident in the first ever self-harm. So that gave us an idea that you can see this pattern of deterioration over time. So that was exciting. We then,
before you go into the next exciting bit, so another thing you mentioned also with this earlier in the conversation was you've done a lot of work on co-creation, and I know that's permeates all your work, but the card sort task also was co-created, wasn't it? And you did all the cafes, the what do you call the scientific cafe approach?
Cafe Connect, yeah.
And so maybe tell us about your experiences of doing that sort of co-creation work, especially in an area which historically people have been reluctant to involve people with lived experience, often out of fear.
Yeah, and it can be terrifying, actually, not for me because of the subject matter, but because you're held accountable by the people for whom this matters, right? So you have to go into that space being fully prepared to be challenged, to be told that you're wrong, to be told that actually what you need to do is something completely different. And the way that we've managed the kind of risk side of things is to partner. So partnerships are really important in the work that we do. So we've partnered with some excellent organisations like Harmless, for example, who are a user-led organisation who have provided us with support and facilitated some of these discussions, and then been on hand for anyone who feels that they need to, after a session working with us, kind of have a debrief and a decompression and stuff like that. So we've always done it very, I would say, responsibly. So I would suppose these days we call it responsible research innovation, which actually shares a lot of properties with patient-public involvement, which is the thing that we do really well. So we moved into doing research in the community, because one thing about many universities is that you don't necessarily feel welcome there. You don't, if you're a member of the general public, literally some universities have ivory towers and barriers, and it feels, well, why would I be welcome in a department of psychology? That sounds, not particularly welcoming. So we go out into the community. So the idea of doing these Cafe Connect events is to go into the community and do the research out in the community. And I think the important thing about the model that we use is it demonstrates you can do research on these tricky topics, sensitive topics, if you do them responsibly. We wanted, having got this research tool, we wanted to see where young people wanted to take it next. So that was the kind of work that we were originally doing in Cafe Connect. And typically for the young people that we work with, they were about 10 years ahead of where I was. So as an academic, we're very careful, and we do our incremental research, and we think, well, we can build on this and do that, and then we'll do that. And so I had got as far to think that actually what this card is doing is really interesting in terms of self-discovery for the young people who are doing it. So they're having these light bulb moments and kind of go, oh, well, that leads to that, and then that happens. So there's some deep mentalization going on, which is fascinating, really, really interesting. And I thought there was something there in terms of, well, this could really help facilitate, a holistic assessment and scaffold some really difficult conversations, especially when, there are no words to be said, or you can't find the words to say them, but there might be a card that you could choose and put it down in a sort and go, this is really important for you to understand about my journey here. I am not ready to talk about it right now, but we'll come back to it later. It needs to be talked about, but not right now. So you can capture all of that information and tailor interventions, hopefully, in a more sensitive, personalized way. So that was the idea. So I kind of got to, this could be a really useful assessment tool. But no, the young people that we were talking to, like, this is an intervention. We want an app. We want this and this. And I was sitting in this first meeting that we had with these incredible young people, one, beside myself with excitement because they were so amazing. Two, terrified. I was like, I don't have the money to make an app. How are we going to get this done? So we managed to cobble together resources to make an online version. So it's kind of the first step to kind of, well, if we were going to develop an app, how would it work online? Could you do it on a computer? What would it feel like? Do we get similar results? And the short answer is we were able to co-create this with our young people through this project. We ended up with a product which we then tested and published a paper on it last year, actually, showing that, yes, you can do this kind of in the online space, you get quite similar results. And we also extended the age range as well. So we weren't just doing it with young people at that point. So that was really powerful. So I suppose the point that I want to make here is that the young people drove the direction. And we were going happily, we were going in a similar direction, but the young people were, they were right. And I do think the tool, as we're co-developing it now, does has interventionist properties as well as being a useful assessment tool.
Well, it comes back to that broad issue of any time you do an assessment, it's an intervention. And you say it's not. And actually, Nav Kapoor's group in Manchester have shown that, even given in the context of broader self-harm, just doing an assessment can be helpful for some people. But Ellen, we're going to come back to some of that work in a second, but I think it's a good time to introduce the Digital Youth Project, which you co-lead with Chris Hollis, who's also at Nottingham. And that's obviously a programme grant, a UKRI programme grant. And so do you want to tell us about that? Because it's really exciting. I'm biased because I'm involved as well. But can you just give us an overview and what the project is doing and all the excitement and amazing work going on?
Yeah, so it is incredibly exciting. So we have, the entire team, it's over 50 people. So it's a really massive program, which I'm very lucky to lead with Chris Hollis, who's a child and adolescent psychiatrist and leads Mind Tech as well, which is a very useful collaboration. So we have a wide range of experts from psychology, psychiatry, computer science, human-computer interaction, all working together to try and understand risk and resilience in the digital world, essentially. So we want to know what are the things that are risky for young people in terms of their mental health, what might be helpful. Okay, so there is a moral panic around digital exposures, engagement in the digital world, but what are also the affordances of that space for young people? So there's that kind of what one theme is around kind of risk and resilience, and then a second theme is around developing tools that might promote resilience and support and scaffold young people and their mental health. So we're developing tools, some of which are being informed by that first theme, to co-create with young people tools that could be used to support their mental health. And we have 8 work packages, which are sort of neat little projects, but they kind of speak across the program as well. So for example, I'm leading work on the card sort task, which we are turning into an assessment tool, an app with a group of young people called Sprouting Minds, who are our young person advisory group, and they are amazing. And that work is also informed by stuff that's going on in other work packages that are looking at existing databases that have really important data about risk and resilience. So the Millennium Cohort Study, and then the study that you're involved with, Rory, which is the ABCD database in the US. At the heart of this work is PPI, so public patient involvement and engagement, and a responsible research innovation. And we have a work packages which sort of brings us all together to make sure that we're talking across each other. So it's a very, very exciting program, and we're about halfway through.
I was thinking that, yeah. In terms of what the deliverables or what the hope and aspiration is, that we'll hopefully have a better understanding of what are the causes of online harms to mental health. Obviously, in some way, quantify some of that, but I suppose recognize also that, like you said earlier about, I think if you listen to the media, our understanding the evidence is lagging back, lagging behind the rhetoric. I suppose this stage, and that we don't know enough yet about the online harms and benefits, of course, and what protects. You mentioned resilience, so I think that's, for my mind, I think that's what's really exciting is, as you mentioned, right, you've got that two components of really genuinely understanding, fill in those gaps, but then try and map that onto interventions. But he's also doing this. I know that you do one of the other work packages that is Purble.
Yes.
So do you want to tell people about Purble? Because Purble is fantastic.
I do have one. I should have brought Purble along because Purble really should be involved in everything. So Purble is a socially assistive robot. It's a very cute, fluffy animal who's introduced to young people as a nervous creature that needs to be calmed and soothed. And Purble makes little noises and shivers and shakes, and you soothe Purble. And by soothing Purple, you learn to soothe yourself. So it's teaching in situ emotion regulation. So this is work that we're doing in collaboration with Dr. Petter Slovak at King's, who developed Purble. And originally this work was done in quite young children, sort of age 6 to 10 years old, and we've been extending that into the teenagers and beyond. So we've got some really exciting findings, for example, with LGBTQ plus young people. So exciting that we're kind of running a bonus randomized controlled trial that we weren't expecting to do, because there seems to be a signal around the impact of Purble on self-harm ideation, which is really exciting. That's an example of tech for good, if you like, digital interventions for good, that this space is somewhere that there are risks, and there might be certain groups who are more vulnerable to the risks, but there is also real scope for responsible innovation and developing tools that can help young people.
Yeah, and then no, and that's really fascinating. And there's also a work package which is looking at Sparks, which is the another digital intervention, cognitive behavioral therapeutic intervention, working with colleagues. It was in New Zealand it was developed.
Exactly, yeah. So it's what you call a serious game,
Yeah.
and you learn the CBT techniques, and that work is recruiting our participants. So as we speak, having gone through medical ethics and all of that, so that's really exciting. That trial is actually happening to see, how we can assist young people who are struggling with, depression in particular with these digital tools.
And then the work package that both you and I are involved in is looking at the interplay between trying to understand using the ABCD data set, as you mentioned, from the United States, trying to then understand the interplay between obviously brain images, brain imagery and self-harm, but more broader than that, obviously looking at trying to look at the interplay between what protects young people in particular in that transition between thoughts of self-harm to acts of self-harm, and suicidal acts. So again, it's what's really, I think, really exciting about the program is you've brought together just all these diverse approaches, and as you said already, lots of different people with lots of different backgrounds, but traditional data linkage stuff together with this real innovation in the digital spectrum, the social robotics type stuff, as well as interventions, or like CBT type interventions. It really is. It's one heck of a task to lead, Ellen. So how do you manage the leading of it? It's like herding the proverbial cats, is it?
You choose really excellent people to work with. That's the answer. That we've known each other for a long time, and I think most people in the project we've known for a while, and they are they're leaders in their field. We've got for example Sonia Livingston and Edmund Sanuga working on the dynamic interplay of online risk and resilience, and collecting new data on that. Which is really important because we've got these assumptions in the field that actually the direction of the arrow is from social media or digital exposures to mental health. But actually the direction of the arrow could and may be, importantly, in the opposite direction. And certainly some of Candice Odger's works from the States is suggesting that actually if you're more vulnerable with your mental health, then that is going to lead you to seeking out certain types of experiences online. And that's what this Diora work package that Edmund and Sonia are leading on is sort of looking at that kind of interplay between those two sides of the coin with children in schools. And they've come up with a new model actually based on their work, which is really exciting.
Yeah, no, that's a great innovation, real innovation there. But no, the point about the direction as well, because the potentially soothing effects of social media in a way. So I think it is really important that we don't. That's why I suppose why I said a few minutes ago is that sometimes I think the digital mental health landscape is that the rhetoric you read in the media is ahead of the evidence, because the evidence, we don't know yet some of those answers, as you say, could go in the other direction, but most likely it'll be bi-directional. And again, the other bit we know from certainly from the suicide and self-harm field more generally is that the media influences, when you speak to young people, of course they have risks, but they have huge benefits. And a lot of young people talk about the benefits of that, finding your tribe or getting support you may not ordinarily have got. So and it's recognizing it, as we know, is that we're not downplaying the potential devastating impact of social media, especially when you're able to access dangerous material, but it's often its impact on somebody who's already vulnerable. I think that's the bit which is often missed, is that there's a lot, people bring a lot of vulnerabilities, and yes, it's trying to understand that complexity. Of course, we need to do whatever we can to ensure that the digital world is as safe as possible, but it shouldn't. We have to be careful that we don't miss this opportunity of harnessing the benefits of social media and the digital world. And that's what's brilliant about this project, because it's looking at these both in a theoretical way, but also in many respects in an agnostic way, going, it could work both ways. It could be good. It could not be dangerous, or whatever it might be.
And I think we actually we don't know which are the activities that are risky and for whom. So something that's risky for me may not be for you.
Yeah.
We really are at the foothills of our understanding about this, and I think it's a new field. And I suppose what we're trying to do in the program is develop the new leaders as well. So the early career researchers on our team are really important, when we're spending a lot of time developing them as researchers, because this is a field that's going to develop and grow. We're just at the beginning of our understanding of it all, really.
As this study focuses on young people, how does social media impact young people differently to older people?
Oh, that's a really, really good question. I don't think we know the answer to that, which is, the truth of the matter. Obviously, young person can be anything from, let's say, 11 to 25, and that's the kind of age range that we are exploring at the moment. And so how things hit with an 11-year-old might be very different to a 25-year-old. And then, as you say, someone who's older. Now, the additional risk for young people is their exposure is happening at a time that's really important developmentally. So particularly in those mid to late teens, which incidentally is the time of life that the instance of self-harm skyrockets, starts to really increase, and indeed suicides, they kind of go up in consonance. This is a time when your brain is reforming itself. So, by a process called pruning, connections that are strengthened that are being used get strengthened, and those that get cut away. Your brain is literally kind of reshaping itself. So that's one really important difference, I think, Craig, that you've got this really important developmental phase that this technology is kind of getting in amongst. Rory, I don't know if you wanted to come in there.
No, I agree entirely. The only thing I would add is we also know is that in that period of adolescence, the young person is much more sensitive to rejection, to shame, or we often describe as social signals in the environment, negative social signals in the environment. So then it's not direct consequences of social media, but we don't know for certain, but it could be then if you're, I was often talk about that psychological thin skin, and it's particularly thin in adolescence. And then if you're encountering maybe in a social media context, bullying or whatever, then you're more likely to be affected. But of course, that's not just in your online world, that's in your everyday world as well. But given we know that you're really at that age are so adolescents are so focused on social approval, especially from their peers, and the converse is when that approval is not approval but is harms, then you're much more likely to be affected, would be my hunch. Well, that's what the evidence would say, but we need to know more, because we don't know whether that added sensitivity has any long-term impacts or whatever those impacts are. And I suppose that's where the Digital Youth Project is trying to build some of that knowledge. But great question.
I think it's a really important point, especially about the kind of the peer impacts as well. So we know that under risky conditions, adolescents will behave very differently than adults. If peers are present. It's not an effect that we see in older adults, but for adolescents, they would rather do something as a risk to their health or their psychological well-being to avoid the social risk. So there's that kind of important dimension to it as well.
Okay, Ellen, so we're coming towards the end of our time together. So I have a couple of unrelated questions at the very end. We try and end with on a different topic altogether. But is there anything else about the Digital Youth Project you want to tell us about before we bring it to an end? And where do people go if they want to find out more information about it?
So there's a website, a very beautiful website called Digital Youth. I suppose the emphasis I would like to kind of conclude with is that the role of the young people that are working with us is really, really valuable. And we were hoping that one or two of them will come along and say they haven't been able to for various reasons, but they have been involved in everything from talking to politicians about what we're doing to, co-creating all the tools, looking at the data with us. So they're embedded across the entirety of the programme. And I suppose I would say to anybody contemplating doing this kind of research is to use, to have the resources to do that is a luxury, but write it into your grants for the future, because it's really important.
Yeah, absolutely. In my experience, certainly as well, the young people have just been equal partners from the beginning, including some of them being co-applicants as well.
Exactly. Yes, they are.
It was really important. And so, yeah, no, it's a model program, I would say, but obviously with my declaration of conflict of interest as well. Okay, Alan, thanks a million for that. So we just try and end, as I say, on two different questions. So the first one is, and you're saying that you've been involved in this field you've been in Nottingham for 20 years, and so have lots of time to reflect. So here's the question, which is, what advice would you give your 16-year-old self?
Wow, it would be quite a long list, but I think top of the list would be care less about what other people think about you. And I think that speaks to the kind of the peer influence of that time, that you're trying to kind of fit in and just, just be your authentic self and just worry less about what other people think.
Yeah, great advice. And then the last one is, you have the choice of anybody in the world, right? Living or dead, famous or not famous. Who would you love to have dinner with, a coffee with, or just an in-depth conversation with, who you haven't had that opportunity yet?
Yeah, I mean, there are so many directions to go with this, but actually, I would love to have dinner with my mum who died,
Oh.
a while ago, and with my children and her. That would be my dream. I mean, there are famous people that it would be great. It would be great to have dinner with them, but honestly, my mum and my children.
Oh, that's a lovely, very poignant way to end, but a great suggestion, Alan. So on that note, thank you so much for taking the time to join us today, and I'm really excited to see how we develop in digital youth and really the amazing outputs that will come from it. And thanks for all your incredible leadership along with Chris on the program, and I'm excited to see what you do next as well.
Thank you, Rory. It's been great.
Thanks. Take care.